But first, we are off to Belfast with Jenny Brown, exploring a breakthrough that could revolutionise the diagnosis of one of the most worrying illnesses for any parent.
For generations, parents have long used the tumbler test to check their child's rash. If the redness fails to disappear on pressing a clear glass against it, then you need to get to hospital fast, because it could be a sign of meningitis. But the problem with meningitis is that sometimes the age-old glass test just isn't enough. And that's because sometimes either the rash doesn't show until a few days after the meningitis infection has started, or it doesn't appear at all. One family who've experienced the tragedy of a delayed meningitis diagnosis are Serena and Cosmin Murasan, when their 14-month-old son Ezra became unwell in 2016.
I noticed he wasn't really himself, was quite sleepy. During the night he was struggling to breathe. The first diagnostic was croup, so he got some steroids and we were sent home.
At this point, little Ezra had no rash, so meningitis wasn't suspected. But just a few hours after visiting his GP, he was rushed to hospital as his condition quickly deteriorated.
It's only then, in the cubicle, that I've noticed some spots on him. And it was actually the doctor came in and she saw them as well.
It was clear that Ezra had the most severe form of meningitis, known as meningococcal disease. It can spread rapidly in just a few hours to the blood and then to the brain, causing life-changing disabilities or death.
And it was a shock when we first saw him in the bed. He was so puffy with fluids and it was so hard.
The lower limbs, from the knee down, they were black. And they told us, look, we don't know at this stage how much of the legs have been affected.
But despite the best efforts of the surgeons, little Ezra had to have both legs and a number of fingers amputated.
We are so happy he was still alive, and there is life without the limbs.
The big problem for testing for meningitis is that it can require fluid to be drawn from the spine and can take up to 48 hours to get results back from the lab. Which is why medical researchers here in Belfast decided to develop something more accurate and, crucially, faster. Dr. James McKenna from the Belfast Trust is the inventor of this new rapid test, which provides a result in less than an hour from a simple mouth swab.
We identified a new technique called LAMP, or loop-mediated isothermal amplification, as a means to rapidly diagnose meningitis. So we put a patient sample here, and then the test works by amplifying up minute quantities of the bacterial DNA. The beauty about it is it does so very, very, very rapidly and very simply.
This means the test can be performed by doctors and nurses on the ward without the need for laboratories. Dr. Tom Waterfield, a consultant paediatrician from Queen's University Belfast, who's been trialling the LAMP test, thinks this faster diagnosis will help save lives.
Tests like this and the work that we're doing here does have the potential to spot really serious infections like meningitis in children just like Ezra much earlier. And what we do think is that if you treat the infection earlier, the outcomes are better. It's possible as technology moves forward, this test could become available in general practice, in primary care, or even in pharmacies.
And with plans to ultimately roll out this new test across the UK, Ezra's mum is optimistic.
I do think this test is amazing, and I really believe will save lots of lives and limbs as well. And we don't want any other parents or their kids to get through what we got through.
And thank you so much to Ezra's parents for telling that story.
So
Hopefully
brave of them.
help many, many families there now.